Thank you everyone for joining us on this fourth day of presentations for telemedicine program planning, implement and monitor. And here's Caitlin.
Hello everyone. Thank you for coming back for our last day on how to implement and design a telemedicine program. So we are just going to talking about the kind of last minute tie-up ends and details. So we'll be going over an implementation plan and evaluation. So at this point, you should have a really good base, a good structure going for your program. You should know what services you need, who's going to support it, where you'll be having it. You have all those major details picked out. So now what do? Are you ready to implement? Now is the time to really sit back and make sure that you've covered those little bit of details that is going to help make this program run smoothly. So I can give you general ideas with this one, but ultimately when it comes down to workflow for implementing, it's going to be up to your individual organizations on how this is going to work. So some of the details to look for, you want to look at your workflow, scheduling, training, testing. Those two right there, training and testing, are really important. You want to make sure that you've tested enough times that everything's going to work as smoothly as you can when it comes to technology, and that everybody that needs training has been trained on the equipment and they feel comfortable with it. Look at staffing, coordinating, marketing your program, kind of start to get an idea of what you think your volume might be and how you're going to monitor your program as it goes through. So workflow and scheduling is really important, and it's just going to be those small details that help make sure everything runs smoothly with this and that there aren't any major hiccups. A really big thing when you're doing this, as with anything when you're implementing a new program, is you want to make sure your staff are really comfortable with this and knowledgeable on it so they can project their confidence to the patients that are coming in. Because if the provider is not comfortable doing it, the patient's not going to feel comfortable doing it, and you really want to make sure you have all the details that this is going to run smoothly. So take a look at what your usual consult looks like and adapt that to your telemedicine encounter. So how is somebody coming in for a telemedicine encounter going to change how you normally do your day-to-day activities? So look at who activates the consult, how it's going to be scheduling the visit, how's the information charted, how is follow-up done to make sure everything is where it needs to be and nothing's been overlooked on the patient side as well as on the charting side. So this checklist is one of the last stages of the checklist you have to do from that first week. And it's really just going to help you go through those details to make sure that you've planned your program appropriately and you are suitable for the technology that you're using in your space. So this is just an example of a flowchart. I am not saying you have to do a flowchart, but some people like them. I know they can get really complicated. This is just one example of how telemedicine can work in a primary care situation. The flowchart is in with your handout. And I cannot stress enough the details when it comes to your implementation plan. Before this, with your needs assessment, your readiness assessment that you were doing, when you were looking at the technology that you needed and creating your outline, yes, details were important, but really ultimately you were looking at the program as a whole and you were looking at it as the big picture. For your implementation plan, now is the time you're really going to focus on the nitpicky details. Test and train and do it repeatedly. Make sure you have multiple staff trained on everything and make sure you have multiple areas tested. So if you're setting up this telemedicine encounter and you don't have a designated room that this is going to be in, make sure you're going to test in all the different areas an encounter may happen so that you know how it's going to look on each end, how it's going to work with connection. Maybe you have one room that really the connection for some reason just doesn't work good. But now is the time to find that out before you have your encounter. And don't be shy where training can take a couple of months. This is not something where you're going to have it rolled out and training done in a week. Scheduling, as you know, does not work like that. Everybody's schedule is different, and it's going to take a little while to make sure you have everybody through and trained appropriately on the equipment. So another big part for this last stage with implementing is promoting your program. And so you've got the details down of how that physical, actual encounter is going to work. So why promote your program now? You think it's going to run really smoothly, you've got everything down. Promoting is big, so it's going to educate and inform staff and community. It's, you're trying to produce a new innovative way of providing treatment, and you need to make sure that gets across to everybody. So when promoting your program, there's a couple of things to look at. You want to look at who's your audience, because that's going to help determine how you're going to be promoting your program. And you need to figure out what the best promotional vehicles for reaching your audience are, and don't be afraid to use multiple. And you can do direct mail, you can do print ads, website, and the other thing with this is look at how else you've promoted other programs you're doing and utilize that, so that way your message is coming across as the same as you've done it before, and you continue to create a cohesive. And when you're promoting, don't forget to remember how familiar your audience is with your organization. So if you're promoting internally to your providers and to your staff, you don't necessarily have to worry about this as much. But as you start promoting into your community and your patients, really recognize what level they know your organization at. Are you focusing on, patients that are already coming in, that are already established, so they already kind of know what you do? Or are you just kind of doing a blanket promotion on this telemedicine? And in that case, really, this is a good time to throw in what else that you do and show how telemedicine is working in your organization. Okay, we already went over that one. So the other big thing to focus on with promoting your program is the most important feature of telemedicine to your audience. Do you want to stress that you're saving travel time? Are you stressing the ability to access a specialist that they normally could not? And that goes for not just your patients, but also for your providers. How do you want to promote this program to them? If you've hit provider hesitancy still at this stage and you haven't been able to really get everybody on board, promoting your program to that staff is going to be very important, because you're going to be able to look at how it's going to benefit them. And then, what is your call of action for your promotion? How are they going to interact with this telemedicine encounter? Is it something that is going to happen when they call to make an appointment, so their front office is going to walk them through how this is? Is this something that when they show up in the ER, they may be seeing telemedicine? So once you've promoted your program and you've got your details down and you've actually started to implement your program, really almost there to do, maybe you've already done your first patient encounter as a trial. Never forget to evaluate your program. Evaluation is extremely important because it's going to tell you if your program is working. It's going to help you catch problems. It's also going to show that you have an effective and efficient program. And as you look for funding and as you look to expand it, that area is really key to show that telemedicine is truly working. And this is also a process for you to learn for future programs. And there's two ways to do evaluation: process and outcome evaluations. So process evaluations are going to look at your program as a whole, while outcome evaluations are going to measure the change that has actually occurred as a result of your program. So you can look at one or the other, but I strongly encourage to make sure you're evaluating both. By evaluating, doing the process evaluation, by looking at your program as a whole, you kind of have this big picture long term that, yes, this is working and this is why it's working. Your outcome evaluations are going to be those nitpicky data to really focus in on exactly why this is working and where this is working, or if it's not working, you can target that area where it's not working, and now you have concrete proof to move forward. And think back, if you did a logic model, think back to your logic model. Your objective outcomes are going to equal your outcome evaluation when you're designing them. So evaluation is really important, but how do you actually evaluate your program? You don't need to reinvent the wheel when you do this. Look how you monitor and evaluate other programs and apply that to telemedicine. Look at your encounters. Maybe you can survey patients and physicians. Maybe it's just strictly monitoring how many encounters that you've had, and then there's a couple questions you do a follow-up with. If you did a logic model, use your objectives when it comes to this. So if you decide to do a survey, which they can be useful, I know people feel surveyed out all the time. You know, you're constantly at the end of this, you want a survey, people want to know how they're doing. And if you can really manage to create a short, sweet, and simple survey, it's going to be really great for making sure you're in the right path for this program. Because surveys technically are going to look at your how, your why, who, when, and what. That's what you want to concentrate on when you're developing a survey. Make sure it's short, simple, and specific, and it's also going to help you take your evaluation to the next step. So if you're just collecting data that you'd find in a patient's chart for how to evaluate your effectiveness of this program, adding a survey is going to take that to the next level, and you can kind of dig a little bit deeper. Now, surveys are not just for patients, they're for providers as well. When you're doing this program, don't forget to look at both sides. You want to make sure your patients are satisfied, and you want to make sure your providers are satisfied. So these are some possible survey questions for patients, just to give you a general idea of what you can ask so you can get some information out of it. Remember, you know, yes or no questions are really good. So with scaling, they're short, simple, they're quick. A lot of times when you ask somebody to write, you know, any expressing anymore for actually typing in, you don't always get a response back, but you can include them. There's always somebody who will do that. For their providers, here's a couple of sample questions as well that you can look at, and it's just a couple quick ones to really make sure you're still on top of the program and everybody is feeling comfortable with it. So like I said before, these steps are your detail steps. You started out really broad with this needs assessment and a readiness assessment, and as you've gone through this process, you've narrowed it down, and you're really starting to focus on the details. And that's what's big about implementing your program, is that last step is you're focusing on those little tiny details to make sure everything is covered. So now that you're at this point, celebrate a little bit. You know, you deserve it. This has been a long process for you to get through, and you need to make sure that this is still really exciting for somebody to be able to do. So celebrate, and then start the program and work out the kinks. Because as you do it, and as I'm sure everybody is aware, everything can look great on paper, and it's going to go really smoothly when you look at it in paper. When you actually start to go through that, there's going to be bumps and hiccups and hurdles that you didn't think about and nobody else thought about. So it's really important to not get discouraged when you start doing this. If you run into some resistance after you've implemented it, just go back to the beginning. That's why you did those logic models and why you did the outline or the business plan and those needs and readiness assessment, is you now have that base to go back, be like, okay, this went wrong. Why did it go wrong, and how can we fix that? So not only has this process helped you develop your program, but it's going to help you keep your program up and running. So this is your very last checklist on that first checklist that I did. There's two. There's an implement a telehealth program checklist and an evaluate and improve program checklist. So really 4 simple questions, and once you have yes checked off, you are good to go. And then this is for after, 2 simple ones, just to make sure you are staying on top of your program. So I know this one was, you know, the shortest of all of them, but really it's just focusing on details. And when it comes to your implementation plan, because it's going to be so organizational specific for how that workflow is, there's only so much I can give. But if anybody has any questions, please type them in and we shall start answering.
So the first question was about rotating the view on the reference document. When you open your PDF, there's a view tab and there's rotate view. You can go clockwise or counterclockwise, and that way you can view the document on your screen in the correct direction as opposed to having it be sideways.
Sorry about that. That's kind of how it got scanned in. I wasn't trying to give anybody a kink in the neck. I mean, as you go through this program, it's really big, it's exciting, and the technology is new. And it's not always all about the technology when it comes to telemedicine. It's about providing a new way for continuing care. But don't forget as you're going through this that this is a disruptive technology. This is something new, and it's happening really, really quickly. So you are going to hit hesitancy, but as long as you understand that this is something so big and happening so quickly and a much faster rate than what it normally happens in healthcare, if you can just keep that in mind as you're going through and don't get discouraged, just remember to do education sessions, sit down and talk, and really find out why there's hesitancy towards it, because then you can research and provide them the information they need.
The next question was about sending out what's covered with Medicare.
Yes, I did. I sent it out last week with the emails that went out for the copy of the presentation. What Medicare has is a list of codes, and it should also list what is required for the originating site. I can send that out again.
Okay, and we'll give it just another minute. If you have any additional questions, please feel free to type them in.
So I'm going to be sending out this final slide presentation is going to be going out to everybody. Hopefully by tomorrow, there's going to be, speaking of surveys, there will be a survey attached for you to fill out to evaluate how this presentation went, and it will also have a link to all the recordings and slides. So I'll be sending that all out at once, hopefully by Friday, Monday at the latest.
All right, it looks like there's no additional questions, so we'd like to thank you again for taking a fourth Wednesday lunchtime with us. As Caitlin mentioned, copies of the recordings and all of the documentation will be posted, and you will receive an email once that's done. And again, thank you already in advance for your participation with the survey, as your feedback is very helpful in working on future presentations. Have a great day.